Hey everyone, welcome back to my channel. So I thought I don't know if I'm going to do this every single week. I'm not 100% sure yet, but I thought it'd be kind of cool for me for myself, and if anybody wants to keep up with doing like a weekly clinical update of how clinical is going every week, just so I can have kind of documentation for myself, but also I can just say like the type of patients that I'm seeing. Obviously I can't say details because of HIPAA and patient privacy and all that, but that would be nice to just do like a recap, see if it was like a good week, if it was an okay week, if it was stressful or whatnot, just so if people are wondering, they can get kind of an idea of how clinical is going. If you're thinking about becoming an FNP or going to FNP school, clinical is very different now than it was when I was in nursing school. So I'm just gonna stick with FNP clinical for now and just do like a weekly raw update each week of how clinical is going. So if you're interested in that, please keep watching. Hey guys, so it's just me editing now, and I noticed that my tongue is like bright blue. Please don't mind that in this video. I had one of those, I think it's like a raspberry slushy type things from McDonald's, and I did not even realize that my tongue is bright blue. So please excuse that, and please continue watching the video if you are interested in this topic. So this week was my first week of clinical. I am doing an adult rotation now. Throughout my program, we have to do adults, we have to do family, pediatrics, as well as women's health, which is OBGYN. So right now I'm doing an adult clinical, and it was my first week. It was my first rotation ever as far as clinical in FNP school, and it was a really great couple of days. So I'm only doing twice a week now because for each different clinical you are required to fulfill different amount of hours. So there's not as many hours this semester as there will be probably in a couple semesters from now, which will be family, which requires a lot more hours because obviously that's the specialty personally I'm going into. You know, I guess it depending on if you're doing a pediatric NP or if you're doing geriatric or whatever, you have different, you know, requirement in hours. So I'm doing that. I have worked 2 days and it was really, really good, but I was so nervous. I think with anything, with anybody in any situation, the unknown is sometimes more scary than when you actually start doing whatever it is that you're doing. Cause cause I started on Monday, and then Sunday I was just kind of anxious. I'm like, oh my God, like it's coming up. And it's like, am I ready? Am I going to be okay? Am I going to completely freak out? Like what is going to happen? And I was just, you know, I tried to keep myself busy on Sunday, and I did a pretty good job of it until, you know, Sunday night. And you're just thinking, first of all, I'm always scared that I'm never going to hear my alarm, or I'm never going to get up in time, and then I'm going to be late, and then it's going to be a whole thing. And I'm just like, you know, you have so many worries. I don't know about you, but I always have, like before school starts, I always have a dream that I'm either late to school or like I can't open the door to get into my class. It's just crazy. So obviously I had, you know, just a lot of worries and all of that stuff. But when I actually got to clinical, it really wasn't as bad so far as I thought that it was going to be. Obviously when you're in nursing school, you have clinical at the hospital, and depending on what program you have, you might have some experience outpatient, but it's not going to be your main focus. But since as a family nurse practitioner, you are in an outpatient setting, that is what all of my clinicals must be. And I don't know if I've ever mentioned it before, but I much rather be outpatient. I love outpatient setting. It's more controlled. It is still chaotic in its own way, but it's definitely more controlled. In my personality, fit much better outpatient than I would inpatient. If I had to work inpatient, it would just not work well for me at all. I don't have the personality. I don't have that hustle that a lot of people do have. So this is kind of my zone. And it was just so nice to be able to start clinical, doing the specialty that I want to do, in the setting that I want to do. And it was just like, it's like I got a little emotional because it's like finally I'm here doing what I want to do. And even though it's not the specialty, like I think I might want to do either maybe primary care, maybe dermatology. I'm not 100% sure yet, but like it's that first start to you working and doing what you want to do and being in your career. And it was just, it got a little emotional for me. I mean, I wasn't like sobbing or anything, but it's just like, wow, like I'm finally here. And it's kind of crazy. It's kind of cool that, you know, you're in that provider role now. Obviously, you know, you're not there yet, but you're getting to that point and you're practicing, and it was really cool. So I was there for 2 days. One day was like a half day and the other day was like a full 7:30. Well, we didn't see patients till 8, but like 8 to 5 type situation. And the first day I really wasn't expecting to see any patients, but I saw a patient and by myself. And I was just like, my face turned bright red like a tomato. I felt myself getting so hot. If you've seen probably one of my first few videos when I'm a lot more nervous, my face turned red, but this was worse. Like I felt it like heat, you know, the heat, and obviously you have to wear a mask, so that's even more heat, and like it was kind of hot in the office. So I was just like, oh my God. It was kind of nice to have that mask to cover my redness because I was so nervous. I mean, luckily the patient was only there for like a medication refill, so it wasn't so intimidating as my first patient to see. But of course you're always nervous and you don't know how you're going to react in that setting. You don't know how you're going to present yourself. Is the patient going to care that you're a student or not? You know, are they going to be receptive to you, whether you are a student or not? Are they going to be receptive to your personality? Are they going to listen to what you're saying? Are they going to blow you off and just wait for the doctor? Like, there's just so many different things coming to mind. And I'm like, oh my gosh. Luckily, my very first patient and everyone that I had seen so far has been very receptive to students. She was very, very, very nice. Appreciate the fact that my first patient was, you know, it was a positive experience. And then that gave me like the confidence to say, okay, I don't know what I'm doing yet, but I'm starting to know how to at least present myself as a provider position with my patients, because obviously different career paths, you have different levels of responsibility and position, and you have to adjust your way and depending on different situations and whatnot. But I'm starting to figure out how I'm going to present myself and how I'd like to present myself when I actually do start working. So it was definitely a great first day of experience. I was exhausted, even though it was a half day, because I didn't realize there is a definitely type of hustle in outpatient. It's definitely different. You're seeing patients here, and like you need to learn quick. In the place that I'm at, like you have to learn really, really, really quick. And sometimes I take time to learn things, but I kind of like the fact that we're very encouraged to learn things now, because it kind of opened my brain up like, oh wow, like I know more than I think that I do, because when I'm talking to my patients, you know, information is spewing out that I know is in there. But sometimes when you're in a need type situation, information just comes spewing out. And you're like, oh wow, I really didn't know that. But if you take the time to think about it, sometimes you're overthinking things, and then if you're in like a quick situation, you just have the information that you need. Like, I don't know if I ever mentioned this, but when I was in nursing school, I went to Peru to do provide care. And I speak a little bit of Spanish, but not a whole lot. But when I was there was a need for communication, and I was the only one in our little group that had some level of knowledge of Spanish. So all the Spanish words and terms and sentences kept coming to my brain because there was a need for me to communicate, because if not, what are we going to do? So anytime you have a need, like your instincts kick in, and you know, your brain just knows what to do to kick it in gear and get things done. So that's kind of how I felt there. And it was a very huge confidence booster, because, you know, now that I feel like I'm figuring out a way how to present myself as a provider, now I can, so I ran out of storage on my phone, so it just cut me off. But what I was saying before is that in terms of clinical, I think there's two parts to it. It's obviously learning the information, how to diagnose, prescribe, all of that stuff. And it's also how to present yourself as a provider Also showing confidence that you know what you're doing, you know what you're saying, creating a rapport with your patient so that they feel that they can trust you, that they know that you're doing everything in their best interest. Those are two very separate but important things to be a great provider overall. You need the knowledge, but you need the communication skills to work with your patients. So I feel that now that I'm really learning this part of knowing how to present myself as a provider and presenting information in a great way where I can provide that love and trust and support in their best interest, that I can focus on this part, because this part is relatively same for all patients. You know, you're the same way and how you, and your personality and how you're going to present information, and you know how to adapt depending on the patient. So now you can really focus on the actual information. So that was really kind of reassuring for me. So I really appreciated that. And it was really great that I got my first patient done and out of the way on the first day, because it's another thing with waiting with the unknown, you know, oh my God, how's it going to go? So at least I got that done and out of the way. And it wasn't a patient where there was so much going on where I would have been extremely overwhelmed. So with just a medication refill, that was, I think, a really nice transition. And then the second day I saw two patients, and one was doing like an allergy test, and one of them was like a hypertension test, type patient. And those were extremely interesting. Obviously, I'm not going to say any type of detail because of HIPAA, and I don't want to talk about any patients, but it was just really interesting seeing all different types of patients, seeing how they react with you, showing that, you know, when you're in clinical, you know more than you think you do, and I promise you do. You're going to be like, no, I don't believe you, but you really do. Because when I started talking to one of my patients, I was spewing out information that I knew I had in my brain, but it just like, it flowed, and just things started making sense. The patient was asking me questions that I had answers to, and that's where I was like, wow, okay. I literally like looked at myself and was like, good job, Nat, like, okay. But you know, you just, I don't know, you're going to surprise yourself a lot, I think, throughout clinical. I am already surprised with myself with 2 days. I'm excited and anxious to see what's going to happen throughout this semester and throughout other semesters to come. But brace yourself, give yourself a break, because you can do it. It's going to be scary, but you know more than you think you do. You're stronger than you think you are. You're braver than you think you are. And to me, the scariest part is when you're knocking outside their door. But once you go inside, have eye-to-eye contact with the patient. Oh my God, I forgot to turn this down. Have eye-to-eye contact with the patient and start talking to them, and it doesn't seem as scary as it did before knocking on the door, you know, seeing who your patient was. And when the first second you see your patient, you should make eye contact. Hey, how are you doing? My name is Natalie. I'm a nurse practitioner student, and I'm here to take care of you today. Say something like that so they know exactly who you are, what your name is, what you're there to do, and make them feel comfortable. You know, maybe compliment them on their shirt, saying, oh, how are you feeling today? You know, it's today treating you well, you know, anything like that. So you get that, you break the ice quickly. You don't sit there and be like, okay, well, I'm here to take care of you, and I think I'm gonna check your blood pressure. You know what I mean? Like anything like that. Go in there confident. And someone told me, and I've seen everywhere, fake it till you make it. And I know that, and I've heard that, and I'm just like, I get it, but I don't really get it. But when you're in that setting, you need to make sure that your patient thinks that you know everything. So what I mean by that is go in there with confidence, go in there with assurance of what you're saying. If you don't know something, that is okay. Whether you are a student or you are an actual physician, that is okay. But don't say or make something up for your patient just so that they think that you know something. If you don't know, be honest about it. Say, you know what, I'm not really sure about that, but let me go talk to the doctor, or let me look up the information, I'll get back to you. They appreciate that so much more than you making something up or saying some whatever crap that comes to your head just to fulfill whatever question that they had. One of the patients asked me something specifically, and I really didn't know. So when I was just like, I appreciate your question. I'm really not sure about that. Let me go take a look and I'll get back to you. And so I did and came back, and she appreciated that way more than if I just try to say, I think it's like this, or don't do that. You know, go in there with confidence, go in there with reassurance. If they ask you a question, answer it really nicely and professionally. If you don't know it, it's okay. You're not going to know every single thing. Have you seen the textbooks of any healthcare student? They're huge. They're huge. You're not going to know everything in there. Okay. And this is just for one class. And sometimes one class has a million different textbooks. You think you're going to know every single piece of information that is in these thick textbooks? You're not. And it's okay. And I keep telling that to myself all the time, because obviously, you know, we all have insecurities when going into clinical or going into the field. You know, you might think you know your stuff, and then you go out there and you feel dumb as crap. I mean, to be honest, and it's okay. And we're learning and we're growing and we're evolving. And now going through the patients that I had, now I know what to do when I see patients like that come in again, whereas I didn't know. And I heard this, I can't remember from somewhere, but you don't know what you don't know. And I really didn't understand that until now, but it's like, okay, now I know what I didn't know before, so I can improve on that. And now I know how to present or how to, you know, assess different patients that I already had seen, and I can reapply it back to them when they come see me again, or another patient that has the same type symptoms or, you know, concerns. So you're going to learn. It's going to be okay. It's going to take time. But what I want to say is to enjoy the process. I really enjoyed being in there. I really enjoyed doing clinical. I like the hands-on. I like the tactile learning. I like, for me, it's visual and tactile. So this is my time. If you tell me something, I'm not going to remember. So when you go in there, and if you're not an auditory learner, when you're talking to your patient, when they are talking to you, write in your chart, write down on a piece of paper, whatever you got to do, but write, so that you have that in front of you, so later on you can go back. Because if you don't remember, I don't remember, and pretty much anything someone tells me, it goes out the other ear. I'll be completely honest. So when I go back, and if I don't write anything down and I go back to see, you know, if the doctor's like, oh, so what did the patient say? Did they have this? And I'm like, I don't know. I don't remember, but I got it on my chart. So yep, this person said this, that, this, whatever. Do what you got to do to translate what the patient is telling you into a way where you understand. If you know and remember things auditory, then great. If you know things visually, write it down. Let the patient, you know, just like how when you talk to the patient and if they learn by, you know, visually, provide them a piece of paper and go over it with them. You know, just like how you want them to learn in their way, make it so whatever information they're telling you, you make it into the way where you understand and you can regurgitate and you can present that information to your provider or whomever you need to present it to. So that's going to be it for this week. I feel like I haven't been there that long, and I've already learned so much, not just about the healthcare system, not just about the patients, but about myself. I've surprised myself way more than I ever thought that I could. Of course, when I first went in there, I felt beyond stupid, especially since like we're getting like quizzes here and there. Oh, what is this? What this type of medication is this? You know, this connects to this and whatnot. And you're just like, what was that word again? You know, like you remember hearing it many years ago, and then you're just like, oh my God, what is that? But then you start to remember things. Your brain, it feels like it opens up and it just wakes up. You know what I mean? Like you just start spewing out answers here and there. And when someone reiterates it to you or you apply it to a patient, you will remember it so much better than just reading it through a textbook. I promise you. It's going to be fun. Enjoy the process. Get a good preceptor. I know it's extremely difficult to get preceptors at all, let alone one that you really like. But if you have the option, really let them interview you and see who you want to work with. Get someone that's going to challenge you, because right now when it's going to suck, it's going to be really better when you start working, and when they interview you for a job, they're going to be like, wow, you really know your stuff, and you're going to have a great rapport with your patients, and it's just going to be an overall great experience. So I'm happy to say my first week went really well. I hope it continues. But it's also not just what the clinical setting has for you, but what you bring into it. Be happy, enjoy the process, learn, write things down, take notes, feed off of each other if you're working with other students, and it's going to be there. You have to do this to become an FNP. It's just another obstacle, but it's going to help you learn. Hey guys, this is just me editing. What I wanted to say before is that this is just another obstacle that you have to go through. You know, in life, we just have so many things we have to get through in order to get to the place that we want to get to. And this is just one of those other things. But yeah, that's what I wanted to say. And thank you guys so much for watching. As always, if you have any topic you'd like me to discuss, please feel free to leave a comment down below or email me. Have an awesome day. Remember to always believe in yourself, and you guys got this. Please let me know if these weekly videos are helpful or not. I'll probably try to do one every week just to recap my clinical experience. But let me know if they're helpful. All right, have a great one. Bye, guys.